सेकेन्ड इयर पास
पानी पर्दैन पानी पर्न
Can I have your attention, please? Good afternoon, everyone. Namaste, and a very warm welcome to each of you today's CME session, which is titled Sharper Vision, Deeper Insight, the Subspecialities Approach to Cataract, which is organized by Nepal Ophthalmic Society. I am Dr. Shivani Rayamazi, and it is my truly honor to serve as your MC for this enriching afternoon. Today we gather not just as a practitioner, but as a lifelong learners in the field of ophthalmology, united by our shared commitment to enriching patient care through deeper insight and sharper skills. We are joined by esteemed experts in cataract management who will be presenting their perspectives, techniques, and updates, offering us all an opportunity to refine our own clinical approach. We are very privileged to have among us the distinguished gathering of senior ophthalmologists, consultants, fellows, residents. So our afternoon, it will be structured around a series of focused presentations by our invited subspecialists. And I would like to also inform that this CAV, it carries a CPD point of 1.5. So I would like to request every one of you to make sure that you write your name along with your NMC number. So now to begin the program, it is now my pleasure to welcome our esteemed panelists for the upcoming discussion segment. Each of them is a leader in their subspecialty, bringing deep clinical experiences and thoughtful perspective on cataract management. Please join me in welcoming Dr. Balkumar Kesi sir, who is not only a renowned cataract surgeon, but also one of the veterinary ophthalmologists with profound expertise across multiple subspecialties in ophthalmology. He is the co-founder and chairperson and senior ophthalmologist at Virat Eye Hospital. For our next panelist, we have Professor Dr. Sanjay Kumar Singh sir, the senior consultant ophthalmologist, cornea and cataract surgeon, who is currently the founder medical director of Siddharth Eye Care Center. Now for our third panelist, I would like to welcome Professor Dr. Meenu Chaudhary ma'am, consultant ophthalmologist, cornea and cataract surgeon, who is the immediate past president of Nepal Ophthalmic Society and has also been the head of department at Institute of Medicine teaching. For our fourth panelist, I would like to welcome Professor Dr. Vishwanath Adhikari sir, a respected senior ophthalmologist and a distinguished speaker in both academic as well as clinical realms of ophthalmology. Now, I would like to welcome the current president of Nepal Ophthalmic Society, Dr. Purushottam Joshi sir, to take this speech. Secondly, I would like to welcome Associate Professor Dr. Ranjana Sharma ma'am, who is the current Vice President of Nepal Ophthalmic Society and a renowned oculoplasty and reconstructive surgeon. Next, I would like to welcome Dr. Tepsu Singh Manga, who is the General Secretary of the Nepal Ophthalmic Society and an esteemed member of the Nepal Medical Association, to take his seat. Now, I would like to welcome Assistant Professor Dr. Lily Raj Bamchi ma'am to take her seat, to be our scientific chairperson. So, we will be having two sessions, 4 presentations on the first session and another 4 presentations on the second session. The first session session will be moderated by Dr. Sanjay Singh sir and Dr. Meenu Chaudhary ma'am. So I would like to request you to take the seat. To proceed to our presentation, when the first session, the speakers will be given a total time of 10 minutes. And so I would like to invite on stage our first speaker, Dr. Sulabh Karki, who is a consultant ophthalmologist and who will be speaking on cataract surgery, young ophthalmologist perspective. I'm extremely sorry. So before going to the presentation, I would like to formally begin this program, this academic gathering. So it gives me a great honor to invite a distinguished leader in our ophthalmic community, Associate Professor Dr. Purushottam Joshi sir, who is the current president of Nepal Ophthalmic Society and also serves as the medical director of Meiji Eye Hospital. So we are privileged to have him today. Now I would like to welcome Dr. Purushottam Joshi sir to give his welcome remarks.
Thank you, Dr. My respected teachers, Sanjay Singh sir, Meenu ma'am, Kalpmakisi sir, and Vishnu sir, and colleagues. Namaste and good afternoon to everyone. As we are talking about cataract today, cataract has gone a long change from removing obesity like Sustrukati 200 BC to making it to the spherical equivalent, to the correction of the astigmatism also. This all has come through the development in our technology and our ion power calculation, which has started from the first generation where only two variables were there, keratometry and the axial limb. Now there are, in each and every generation, from regression to the optical to the Convergence formula, we have much more variations. Now we have the AI incorporated in RBF formula, which is based on ray tracing, which gives accurate results. And without much ado, I would like to start the session from the specialists, and we hope that we will have a fruitful lesson. And last but not the least, we should always keep in mind the impact of our practice in no harm, because there are litigations also going on. So we must be mindful about when we always know when to operate and when not to operate, and when we should say that there would be very poor visual prognosis, better not to operate. And we should be very mindful of this because of the litigations going on and other factors also. And we should do the ethical practice. And in this litigation also, I would like to share one thing, that we are all ophthalmologists here. One person gets influenced by other doctors' remarks. So we must be very careful, even if we see other doctors' fault, or we should call him personally, it is this fault, rather than telling patient and make him more aggressive. We should be mindful of this, because we are judged by ourselves only, and we hope we will have a fruitful learning here. Thank you once again. I would like to congratulate Dr. Dili as the NOS Secretary. We have already conducted the leadership program, and now this is going on. And Viratnagar Eye Hospital also, and all the ophthalmologists who are participating here, the panelists, the participants. Thank you very much, and namaste.